The word experience and the word experiment come from the same Latin root, the same word. Experience is a legitimate basis for experiment. One way to do experiments and to gather evidence is to use your own experience. I have no problem with reporting that.
What about the issue of dosing? How much does someone, how do you know what the right dose is when you're dealing with some of these botanicals?
The issue always first is safety. So you want to know what is the possibility of causing harm, what is the possibility of poisoning someone, and you want to stay below that. One of the advantages of using botanicals is that you're using dilute forms of drugs. They're diluted by vegetable matter, by other substances. When we use pharmaceutical drugs, the safety margins are very small. Often a dose of 5 times greater than what we give to a patient will cause significant toxicity. So I think one of the advantages of using herbs is that there is a greater safety margin.
Are there any alternative medicines that you use in your practice, Dr. Knope?
Not at the moment, but certainly if something were proven to be effective, I'd be more than open to trying it.
What is it about, do you believe, what kind of future, Dr. Knope, do you think integrative medicine has?
Well, I think based on my conversation with Dr. Weil, there's very little future, because if you're going to put an LSD trip on the same basis as the scientific method, we're never going to find a language to communicate. And I think it's very important at this point to say that, Dr. Weil, with all due respect, you are not an attending physician who cares for critically ill patients in the hospital. To my understanding, you have never done a medical residency, you don't hold privileges at a hospital, and when somebody really gets sick, you're not there at the bedside calling the shots. And if you were, I think you'd have
Your information is not correct. I have done a 1-year residency. I'm licensed as a general practitioner, which I'm very happy to do.
And you have hospital privileges?
I have hospital privileges now at UMC, and we are beginning to do inpatient consultations.
So if I called you with chest pain, you would be at the bedside making the decisions?
Probably not.
Right. That's the point.
Probably not. And
that's the point.
I am not involved in critical care. That's not my area of expertise.
That's the point. So what I'm saying is...
Nor do we see critical patients in our clinic.
If you want to sprinkle some herbs around the bedside of the walking wounded, that's one thing. But when you are engaged in caring for critically ill patients, you better have your facts straight. And you can't be talking about unproven therapies, because your patient's life is on the line, Dr. Weil, and I think it's very dishonest to say that in fact, you are a mainstream physician when you don't take care of critically ill patients.
I've never represented myself as a mainstream physician. That's part of the problem. I would like to see mainstream medicine move in the direction that I advocate. And if you think that's not the future, you will conveniently put yourself out of business. The future is integrative medicine. This is what people want. And economic analysis is going to drive this, because we are going to be able to show that integrative treatments, that is the intelligent combination of conventional and alternative medicine, will save money. And at a time when our healthcare system is disintegrating and consumers are going elsewhere, it is this kind of analysis that's going to promote this movement.
So Dr. Knope really is not in the mainstream here with his thing. This is the future, you're saying, is integrative.
I think that is the future. It's what people want. It's what makes economic sense.
And more doctors are having to come to this conclusion because the patients are demanding it?
The patients are demanding it, and their own system is collapsing around their ears.
Is there a danger, though, when you're dealing with consumers who are demanding some kind of alternative treatments when they come to you? What about when patients ask you about alternative medicine?
Well, it again is a buyer beware discussion. If I don't know what's in the bottle and I don't know what the dose is and there are no studies to tell me what this drug does, then I can't in good conscience recommend it to you. I think really the bigger issue, if you look beyond our controversy, I think what you're seeing, I agree with Dr. Weil, you're seeing the fall of medicine as it is now. And I think the reason that he is so popular and the reason that over 2 million people, I understand, hit his website every month is that the doctor-patient relationship has eroded to the point that people need some compassion. They need someone to listen to them, to care about them, to care for the patient. And what they have essentially is a cyber doctor who listens to them and tells them things that they really need to hear. But I think this should be a wake-up call to medicine. I agree with him. If we continue along this lines, we are not meeting the psychological needs of our patients.
We have less than 2 minutes. Dr. Weil, what does work when it comes to alternative medicine? What do we know? What are some of the proven therapies?
I think many herbal therapies are proven, many mind-body interactions are proven, nutritional therapies are proven, the role of exercise is proven, the value of spiritual interventions and community support is proven. I also want to say that alternative therapies are one piece of integrative medicine. To me, that's not necessarily the major piece. Integrative medicine is about working with the body's natural healing potentials, with looking at total aspects of lifestyle, which I assume Dr. Knope would be interested in as well. The use of alternative therapies is one piece of this mix.
Do you use, I know you'd say you don't use them in your practice. What about personally? You're an athlete.
Right.
Do you take supplements?
No, I don't. And I think the irony here is that I would actually describe myself as more natural than Dr. Weil, in that I believe that there's a strong evidence that if you eat lots of fruits and vegetables, get your antioxidants and vitamins, minerals from whole foods, as opposed to going to his website and paying $60 a month for these things, that there's solid evidence that that will help. But I think you exercise, you eat right, and you're done. I don't think there's any need to use unproven supplements, herbal supplements, vitamins, or anything that has not been tested, especially at $600, $700 a year. There's no rationale for that.
And you use what you sell.
I use what I sell. I also say that I think fruits and vegetables are the first choice for getting all of the micronutrients in the diet.
We only have about 20 seconds. Will the FDA eventually here step in and regulate supplements?
I think it will have to.
Do you see that happening, Dr. Knope?
Let's hope so.
Gentlemen, thank you very much. We're going to leave it right there. Next, we view a segment produced by our health and medicine producer, Pam White, who talks with a Tucson doctor who is one of the few physicians in the country practicing pediatric integrative medicine.